All right. I'm going to put the microphone. Okay. I do like videos every week, so some people will show up, but they won't stay this. That's good. Where is the city? Where is the city?
What's there?
Could you check if I took it over there?
Yeah,
Yeah?
it's over here.
All right.
I've been there, don't worry about it.
Yeah. I would like you to explain a little bit what is the thermography, because most people, even though the people from my online video channel Healing Cancer in this century, they have been following this work for years. They still don't know what thermography is. Could you please explain to us?
Sure. So thermography is infrared imaging to help monitor for physiological changes on the surface of the skin temperature. So we know how important temperature is when you're dealing with someone's health. Like the first thing that a mother will do if she suspects her child is ill is put her hand on her forehead. So this is a high-tech, state-of-the-art thermometer. And we're pretty symmetrical from side to side temperature-wise. So if there's something on one side of your face, or say the breast, because the breasts are actually, it's very beneficial for breasts because, imaging breasts, because the breasts actually hang outside of the body, so they're cooler. So say if one side of your face is showing like a white hot region, it could indicate an infection or sinus issues, but with the breast it can show a fever in layman's terms.
We had to forgot to bring the microphone, the one that's in the tripod behind. If you could put it somewhere here, it's the one for the lady. That's the only there. Just slowly, there is enough people to get here. I'm sorry everybody, if there is anybody. Put it behind her. So, yeah, somewhere there. A little back. Yeah, right there. Okay, that's enough. Now, Gaea, I understand that cancer, when there is a tumor, the temperature is higher than normal tissue, and there is an inflammation. What don't you tell us about that?
Sure. So I personally don't utilize thermography to mine for cancer. It's actually very beneficial to letting you know, we all know, or a lot of people don't know, that inflammation leads to all disease. I mean, it's the first precursor to showing that something's wrong. Or say if you injured your knee, it gets hot, so it gets swollen and it's hot to the touch. So if we can be alerted to that process, many, many years before an anatomical test like an X-ray via mammography, or even a PET scan, CAT scan, or even an MRI, or an ultrasound, those are structural. They're going to be picking up a structural change. Well, it can take decades, many, many years for that structural change to occur. So with thermography, it can, we can be alerted to inflammation that can lead to a structural change eventually, long before it becomes so problematic. So when it is a cancer that's starting to form, what happens is that your immune system is tricked into supplying that tumor to feed it with its own blood supply. So if all of a sudden we're seeing that there's a region in a breast that's starting to get warmer, it gives us an opportunity to be alerted to that, like a fever. Like it can be a life-threatening fever, if you continue to ignore it, but the mother knows, okay, it's either we're getting in bed and we're having some liquids and rest, or we need to get you to the emergency room. So trying to avoid the emergency room and being alerted to it, so you can kind of go back up that path and figure out what's causing the inflammation. And we know it can be caused by so many different things. So I utilize thermography to really help women in particular, because I'm very dedicated to breast imaging, is to let them know they can see the images right then and there. So it opens the conversation, because we're very visual creatures.
Exactly.
So when women can see, wow, I'm really inflamed, because a lot more women actually die of heart disease than they do breast cancer.
Yes.
So systemically inflamed, symmetrically inflamed could indicate, a hormonal issue, bad diet, but it's opens that conversation. So it's what's going on with you.
The important thing, because people are concerned, especially women, about cancer, that a chronic inflammation, let's say inflammation for years, may lead to cancer. So with thermography, women are able to prevent. It can be used successfully, very successfully used, in my opinion, as a prevention.
Right. Like the actual camera doesn't prevent cancer.
Oh, of course.
Right. But no, I know, but a lot of people get confused. I mean, there's been a lot of flack because people think that some thermographers are claiming that it can actually prevent it, but they're misunderstanding. It can actually help you prevent it.
Oh, no.
And I'm not saying that you're saying that. I just mean your audience, just to.
Well, I never heard that, because if it's an imaging, the thermography, the only thing that tells you if there is inflammation. So for people, but it's important to clarify. And from there, the client has to reduce somehow that inflammation.
Right. So most people, the average person, doesn't even understand that. Like, they wouldn't even know that, like, wow, that one of my breasts is warm. What would I do? Like that the word inflammation, like, we know what that means, but what does it mean? Like, to you, because everyone's inflammation is specific to them.
Yeah.
And that I've imaged thousands of women at this point, and what I've really concluded is that the foundation for inflammation starts with emotions and energy and who you're around. Do you like your life? Did you just move? Are you divorced? Are you taking care of an elderly parent? So that's how I use it. Like, we look at the images and it's like, what's going on with you? Because we're all so different. So that leads to, it cascades into bad diet, which unbalances the hormones, or maybe drinking or destructive behavior. So when women can see that, they know it's time to put the oxygen mask on themselves first, so they can be around to help others. So, my mother died of breast cancer when she was only 49. So I had an unusual experience that most haven't had. I was with her when she was diagnosed, and they put you in a state of fear immediately. Like, they're literally like, they make you feel like, that's an alien that's going to burst out of your chest and kill everyone in the room if you don't, comply, by having surgery and then treatment, and then, what ends up happening, and nothing has changed. My mom died in 1991. Is that you go through the cut, burn, and poison, and now you've unleashed, the lion, and now, the stem cells can be traveling. So normally, within a few years, unfortunately, it will come back and metastasize into another part of your body. So it was too late for her, but she and I ended up going down, because it had metastasized into her bones. So she and I went down to a clinic close to the Mexico border, and I was only in my 20s. Well, that saved my life. So, it was very tragic what happened to my mother, but there was a positive. I learned that genetics has very little to do with it. And my poor mother, was relieved to find out that she didn't damn me to a higher risk of breast cancer. The only risk that I have is that I have breasts. And that, the genetics has very little to do with it. It's more about you repeating your parents' behaviors or overcompensating in the opposite direction.
All right, but you just said something very important. And before you mentioned that when you see this inflammation in the breast, you start asking your clients, what happened with your emotions? Do you recognize that in your mom's life there were...
Oh, absolutely.
Okay.
Yes.
But that there were traumatic events, and probably in the romantic relationship that led to that inflammation that became cancer later on.
I do think that it does have a lot to do with the fact that we're not taught how to be mindful, or to learn how to heal your broken heart and let go of resentment or being too hard on yourself. So she's a good example of coming from a very abusive family, family situation, and she held a lot of it in, and because her mother was such a tragic situation for, raising children. She probably shouldn't have had children, but was very abusive. My mother overcompensated and was trying to be the perfect mother, the perfect wife, the perfect friend, always with a smile on her face, without really addressing some things that are going to manifest into a disease eventually. So, going down to that clinic and learning those things that my mother learning that she hadn't damned me, because I think that's tragic that we make women feel like they've damned their daughters to a higher risk, which is completely a myth.
Yeah.
So, how relieved she was, and I was relieved because I found out, I learned at that clinic, it was all about me. Like, I need to be responsible, I need to be mindful, I need to make sure that I surround myself with positive energy, meaning people, or do you like your job, and chronic stress, like being in a bad relationship or a job that you don't like, tends to manifest into disease, some type of disease.
When I was working at the Valley Cancer Institute at Hyperthermia Integrated Cancer Treatment, I started doing interviews to people who were healed or cured from cancer. That's the term. Hyperthermia is the fourth modality after surgery, radiation, and chemotherapy. And after I did the interview, all women that had breast cancer, they were cured, or ovarian cancer, we finished the interview and they start telling me about the traumatic relationship with the husband, with the boyfriend, with the lover, whatever. And then I start thinking there must be a connection between traumatic events in life and the breast cancer. Now, having this wonderful tool that in general, as she said very well, the thermography is not going to heal you from the cancer, but will tell you that if there is an inflammation, we need to take care of our body. Whether it's emotions, hormones, diet, whatever. But there is something that is producing that. It's just the body reacting and telling you, hey, there is something that you have to modify, right?
Right, it's a symptom of what is the cause. So,
yes.
And helping women, it's my goal. Like, I live up in San Luis Obispo, so I have connected with a wonderful community of healers. So, be it that they're optimal whole health practitioners. So they get to know their patients. They want to know about your life and how much stress you're under now, or how much chronic stress that you've been suffering from, and start there, because the foundation, the emotional foundation, it's almost like trying to figure out the meaning of life. Like, you'll never have it totally figured out, but being mindful and learning the tools that we can do to breathe deep and be calm and not, continue the pattern of reactive, survival, like you're constant in that state of survival and trying to be everything for everybody. And, it's just a stress. I mean, our world is getting more and more stressful, so being mindful of that and trying to be calmer, things go more smoothly when you're calm. And so I try to really connect them with the right community. So when a thermogram is showing that there's inflammation, and most people don't even know where the first step to go, I'll give them some connections and they can figure out which path resonates with them, because we're all different.
Exactly.
So you and I can have cancer, and you and I could take the same path and have a totally different outcome, because we're different. So really finding out what we're capable of and what we're willing to do to help our bodies heal, and never feel like, in my opinion, all I can speak to is from my experiences and what I've concluded is that we really need a new definition of cancer, where it should be treated more like a chronic condition, because I don't believe you're ever healed. Like, it's not cured.
Exactly.
It's like we all have cancer cells, and so it's about, like, so say if you had HIV or hepatitis or herpes, it's like to not get around a situation that might trigger to make you more ill. So you just get more protective of your spirit.
Well, you said something very important, and most people, even though they have heard it 100 times, and is when you find someone who has inflammation, you refer them to specialists. So those are holistic practitioners. And holistic means that they see you as a human being, physical, mentally, spiritually, nutritionally, the hormones, and everything that you need. And for example, if somebody has a serious chronic health condition, yes, we need to address our emotions, but at that time your immune system is not working well, so you need better nutrition, maybe hormones, maybe something else. So you have to do everything. If you go just to the energy healer for the emotion, that's great, but you have an emergency situation.
Exactly. Yeah, definitely. You have to. It's like a symphony. It's
Exactly.
like it all works together. It's like if one of the instruments is out of tune, or you're just tuning one instrument, that's not going to help the whole picture.
And now comes the $1 million question. Why did you do this movie, this documentary, the breast expose? Why, being a thermography, whatever, practitioner, why did you do this?
The reason I did it is because when I was working in Los Angeles, I was working in the entertainment industry and film and television, and that kind of evolved into working in the corporate end of it. And I, traveled that path for a long time, and I ended up being Arnold Schwarzenegger's chief of staff, helping him get elected. And then once he was elected, I needed a break. I needed to get off that hamster wheel, and I ended up moving up to San Luis Obispo. Well, because of the experiences I had with my mother when I was 33 living in Los Angeles, and I'm 56 now, my gynecologist was telling me I was at high risk and I needed to start going to have mammograms. And after seeing what my mother went through, especially with the mainstream medical world, and also learning what I learned at that clinic, it wasn't for me. It wasn't that I was against anything else that anyone else would choose, but I never bought into the pink ribbon campaign or that culture or the fear. I didn't fear cancer. I just wanted to focus on, trying to stay healthy, and how could I empower myself to do that. So I declined her request to get a mammogram, because I'm like, well, that doesn't make sense to me to have, radiation shot in a 6-inch window right into my chest, into my breast tissue, which we know causes cancer, and it's accumulative. And then the compression, like I saw my mother's tumor, on her breast, and I wasn't about to have my breast compressed because I knew it could metastasize the cancer. So that's when the internet was starting to really, find its feet, and I discovered thermography. And I would go to my doctor here in Los Angeles and get my thermogram every year, and having physiological information, and the doctor would say like, oh, okay, so what are you doing wrong here? Are you, drinking too much caffeine, or are you partying too much, or whatever's going on with you? You need to address it, and then the next time, you can actually see visually the inflammation reducing when you do take action and you're alerted. And we're so visual, it's different than getting your labs, because those are numbers. It's so visual that women are so inspired when they can see, yes, going off sugar and gluten and getting toxic people out of my life, it's making a difference. So anyway, I did that for many years, and I thought everybody knew about thermography. It has been FDA approved since 1982, and I just went on with my life. And when Arnold got elected, I ended up moving up to San Luis Obispo because my father was having some challenges. He never really recovered from my mother's death. I wanted to get him out of LA, so I moved up to San Luis Obispo, and I thought I'd live a much more calm life there. And so I went to try to figure out where I was going to get my thermogram. And I was shocked, so it was an epiphany. So this was in 2008. So I decided, oh my gosh, how do women not know about this? How do doctors not even know about it? So I decided, to get trained and start offering the technology to the local women. And also I would take my case studies and show them to the different doctors that I wanted to work with. I ended up even working with a radiologist down in Santa Barbara who invited me into her practice, because she could totally, when I showed her the case studies, and you can see, if this breast is inflamed, would you ever put that in a vice? Having that physiological information, she was like, it's common sense, it's logical, regardless of what her medical, the AMA or whomever is dictating to the medical world what we can use. So during that my travels and being a thermographer and trying to educate and offering the actual technology to ladies, the women inspired me, because I didn't realize how much fear and how much regret, when women are rushed, down the hall to have their breasts lopped off, and then they're poisoned and, traumatized. And then, if they so many of them, all of them say, if, I could have taken a breath and taken some time to figure out what would have been the best option for me. You just kind of rushed into situations that you regret, because the doctors aren't there with you, the radiologists, and all these, people that are pushing you down that path, they're not there with you.
Let me just say something. You mentioned fear and regret. So the medical community instilled that on the patients,
exactly.
And that doesn't do any good. They traumatize and they make the things worse. And I wanted to mention that I have a client as an energy healer, and she told me last week, my holistic doctor told me that one of the things that I have to do is meditate, because I am running too much. She's a professional, works in the big hospital, and she has a small breast cancer caused by years of stress.
Yeah.
So, and she told me, the doctor told me I need to use my biofeedback machine, and the machine wasn't working. So I told her, bring it here. It was a cable of the sensor broken. I put it together. Now she has her biofeedback machine.
That's great.
So even holistic doctors suggest people to meditate because that reduces stress enormously
Yes.
and takes people out of medication. Let's go back to your wonderful story. So the question was, how did you get to this?
So while I was offering thermography and trying to work with the doctors locally, the local radiologists in San Luis Obispo did not care for that. So I actually had some radio interviews that I had done. I'd run some commercials, and so they, the radiologist associates, Fred Vernacchia, William Ashley, I guess they all worked together, and they complained about me to the FDA.
What?
So I ended up, getting a letter from the FDA. And so I'm from the entertainment industry, and I've worked in politics. So that didn't rock my boat. I'm like, what's really going on here? Like, why would they be
They wouldn't
so worried about me and my infrared camera?
So when you received that information, you didn't get into fear?
No. In fact, it piqued my interest. I'm like, wow, what's really going on behind that curtain? So what I did is I read the letter a few times, and it was basically saying, it is FDA approved, but you can't say it's an alternative to mammography, because mammography is considered as the gold standard. So everything right now, because they deemed it the gold standard, is an adjunct to mammography. So thermography, MRI, PET scan, which is ridiculous. Like ultrasound, it's all adjunctive, even though mammography is very ineffective and very dangerous.
Yes.
So almost completely ineffective for women with dense breasts. So and obviously it raises your level of possibly getting cancer and can spread it, as I mentioned before. So I, read the letter, and I'm like, wow, what's really going on here? And so the radiologist, one in particular, William Ashley, he actually wrote letters to the doctors I was working with, including the radiologist. In her words, he accosted her at a medical conference in Chicago after she was speaking about ultrasound, about working with me. He was like, how can you be working with her? So he was trying to encourage the doctors not to work with me. And they would forward me his emails and show me, like, here he is campaigning to, like, basically try to shut you down. And so they stood their ground, and they, of course, wanted to continue utilizing my services. So that's what inspired the movie. I'm like, women really need to know that this is being kept from them, and that there are other options, and that we have the right to know full transparency of what the benefits and the risks of all of our options, and unfettered access to those options.
Before I ask you what is the documentary all about, and now you have the DVD, you can buy and watch it, what is the reason behind all those radiologists to put you down? May I guess first?
Sure.
Was it by any chance money?
Of course. It's a multi-trillion-dollar industry annually.
This sucks. I need to say in that way, because I see that many practitioners, and that happened in the healing world too, in the energy healing, that people are there for the money, not to help people. And that really makes me upset.
And sadly, I do think some of the doctors mean well, but that's what they've been trained. So they truly believe that what they are doing is correct, and that thermography is not helpful. Because when anyone ever talks, especially doctors, when they claim it's not useful, or it gives false positives or false negatives, thermography does not give any diagnosis of false positive or negative. It gives you thermal data.
Yes.
And it's up to you and your doctor to figure out what is that thermal data reflecting, because we're all unique, that is unique to you, and how to correct problems that you may have. So some of the doctors, yes, especially if they're like running their own, radiology, practice, very financially driven. But some of the doctors, I really feel, just are going by what they've learned.
That's
and they
true.
don't mean harm, but they are causing harm. They are going against their Hippocratic oath. So my website, breastexpose.com, you can definitely purchase the the DVD at this point, and we were accepted into another film festival. So we were accepted into the North Hollywood, the NoHo Sin Fest, which was in March, and now we've been accepted into the Awareness LA Film Festival that will be at the Regal Live, which is close to Staples Center.
When is it going to be?
That's going to be the actual festival is October 3rd through 13th. And we're hoping that our film will show at the beginning of October, the beginning of the festival. So I'll keep everyone posted.
Yes,
when we
please
find
let me
out.
know so I can send an email to my list. And another important thing that you just said, I do understand that doctors go by the book because that's what they study for. However, I remember when I interviewed Dr. Canili, and we were talking about that Einstein said so many years ago, we cannot solve the problems we have created with the same technology we create those problems. And Dr. Canelli, when I interviewed her 2 years ago, she asked me, what kind of iPhone do you have? This one, with a screen, of course, a smartphone. Why don't you use the flip phone anymore? Because I cannot do a lot of things that I can do with this.
Right.
And then she looked at into my eyes and says, what do you think about the technology we are using for cancer? Surgery, radiation, and chemotherapy is the same technology from the, 1940s.
Exactly.
And they are using the same thing that is, the success rate is less than 3%. I work in an integrated cancer treatment. Gaea, we did the breast cancer, prostate, and neck. We used to have 80% and up. 5-year success rate. And the success rate of conventional therapy is not published because it's less than 5%.
Right.
I know that stuff. I work in a cancer clinic. So, as a disclaimer, as a credit for the doctors, they do what they were taught.
Exactly.
However, it's their responsibility
I
in the
agree.
same way that they have to do the CMA to keep them updated, to learn about new things. Because this is a disservice to people. Technology advanced, and we all have to look into thermography, right?
Absolutely. And they actually, in the Hippocratic Oath, to do no harm is obviously incredibly important. But to also, in that oath, it says if you learn things in your clinical practice, it's your responsibility to help train others how things have changed because of the experience. And how we've abandoned completely logic and common sense. Because when I speak to women, and I'm like, follow your intuition, the inner voice. Does that sound like a good idea to radiate in a 6-inch window repeatedly, and they need more radiation the denser your breast is? Exactly, and the psychological trauma and bullying, and if women start to question, they're literally yelled at. I've gone with some patients to the clinic, to the actual imaging centers, and it's really hard to tell them this is my body, and I just want the ultrasound or thermography or whatever you choose. But it's your right, it's your legal right to choose whatever you feel is in your own best interest.
I was thinking yesterday, being a doctor is very easy because a patient comes, they look at the book, this medication, this treatment, and that's it. They don't look at the patient as a human being with the different needs. So there is a deficiency very big.
Oh, absolutely. Because the insurance companies are basically practicing medicine and making it like a cattle call.
Exactly. That's what I said. The insurance and the pharmaceutical industry are the ones who drive the doctor's practice. Because, for example, a simple example, a woman who went through several surgeries, the doctor told her, don't worry, we're going to give you this medication, hormone replacement, because we took your ovaries and you're going to be fine. After a year, the insurance didn't cover anymore, so that woman doesn't have the hormones that she cannot produce because the doctor lied to her. Anyway, what is this documentary all about? So
what happened was after I got my FDA warning, I ended up triggering other thermographers or people who are advocates of thermography to get their FDA warning. So Dr. Mercola was one of those doctors who got an FDA warning. So I ended up flying out to Chicago. He interviewed me. The interview was very successful. It was widely viewed. And then the medical association or whatever their medical kings are.
AMA?
Yeah, I guess, but it's the Chicago, like the
okay.
state one, they then had threatened to try to take Dr. Mercola's license because he was anti-mammography and pro-thermography. So I ended up flying back out to help prepare the attorney for the hearing, and it was successful because, they don't want to put mammography on trial. So they kind of slithered back into their little cave. And so Dr. Mercola kept his, it cost him a lot of money to protect himself, but that's sad. And so then that triggered me into working with Dr. Mercola and having the opportunity to learn so much from all the different experts that he would have fly in. And then he was also working on other projects, and so he needing to stay in Florida more. I said, with my background in television and film production and whatnot, I said, well, why don't you let me do the interviews off camera, and then you can come in and at the beginning of the month and do some intros, especially if it's like breast related or cancer related. And so he allowed me that opportunity. So in this wonderful opportunity allowed me to, so say Ben Johnson comes in, or Joel Wallach, or Ed Griffin, or Carolyn Dean, or different doctors that I was so fortunate to interview, but they were talking about what they were there to share. And then at the end of those interviews, I would say, do you mind doing just a few moments on the breast cancer industry?
Mm-hmm.
What your opinion is of that. And I wouldn't tell them I was a thermographer or had any, my opinion was not shared with them at all. And of course, they were very kind in, allowing me to interview them about that. So that's a lot of the interviews on the documentary about warning women that the mammograms are the biggest scam ever perpetrated on women. In medical history, that cut, burn, and poison does not work, and that we need to link arms and wake up and take responsibility for our health and our lives and our daughters, and teach them. It's like question authority and make sure that you're doing things that are healthy for you. And mammograms are definitely not healthy for you.
Yes.
So I've interviewed Duncan Turner, David Marquest, Dr. V, Veronique de Salnes. So all of these.
Galina Miguelco?
No, just Veronique de Salnes, and Christine Horner. So all of these wonderful doctors who will share their stories and their opinions, and then also women that have gone through terrible experiences with mammography and the broken promises of what they were led down a regretful path. So
I would like to suggest everybody, buy the DVD and get together all the women you know, and you do a Saturday movie night. And this is what I suggest with the Healing Cancer in the Century people who are following. You can buy the collection. I have over 100 interviews, and you invite everybody, and even this video, share in Facebook, share everywhere. And the reason is we need to spread this information because we don't have the money of the pharmaceutical industry or the insurance
companies.
So the only thing we can rely on or ask you to share on the social media, share with friends, get an email right now and tell all the women in your life this information is available. And I don't know, $15, whatever it takes, cost this video is nothing with so many trouble that you can save to women.
Exactly. And we're in such a wonderful time that everything, so much information is now available on the internet. So yes, definitely share, and we have to change this paradigm for our children. We can't allow this. I mean, everyone is sick of being sick. And I think people are really waking up to that.
Yes. Doing this documentary, I know that from the beginning until you went to the festival,
the film festival.
Yes, many things change. What is all the new knowledge that you have by doing this documentary?
I think that just mainly, some of the things that the doctors were sharing, I knew, because I've done my research and I already, had already questioned myself. And my husband was huge in making this film too. He did a lot of the research, Michael Ponzalon. And but I think I learned the most from women. You know, I've imaged thousands of women at this point, and I still image, so I never stop learning. You know, I learn from what they've been through, their experiences, how they've changed their lives. But I definitely see that there's been a change. Like when I first started offering thermography in 2009, and if a woman called, I'd have to explain it to her. People just call now to make an appointment. Like they've done their own research. We have the websites, my centralcoastthermography.com or breastexpose.com has great resources where, women get it. It's like they already doubted mammography anyway. And it's like basically our mammogram's a scam and allowing women to decide. Like we're smart and we can figure it out on our own. And if we choose to have a mammogram after we're educated, then that's our right as well.
I saw the documentary, actually the preview before,
At
the
UTA,
very first, yes.
United Talent Agency.
And I took a friend or a couple of friends, and it really touched my heart, and it's so well done. So I encourage you to take hold of this and share with people. Every time that you have an event, please let me know.
Okay.
I will send an email, because it's extremely important to educate people.
Yes.
Anything else you would like to say?
Just thank you so much. Thank you for the opportunity to come and share my story with your audience. And really thank you for all the wonderful work you do in helping educate people on all different types of subjects regarding cancer and emotions and how it all is linked together and empowering people.
I want to summarize something in our experience. Thermography detects parts of the body, especially in the breast, where the temperature is higher. And the temperature higher means that there is inflammation. And inflammation means that there is something in the body that is producing the inflammation. The inflammation of the body in the breast is the intelligence of the body telling you there is something that needs to be addressed. It doesn't accuse you of anything, doesn't blame you, but it's telling you maybe you're having too much stress, maybe there is something in your life that is causing too much stress. And just by telling this to women, they will know instantly this is right. Because what we have to help is people to make the connection, and thermography is the best tool around.
Right, and what's great about thermography is that you can see it. Like, there's a presentation on my website, or when you see the images, anyone, even an 8th grader, could see something is wrong here.
But there is something important. Tell our audience, especially women, how thermography is done. Definitely they don't press your breast. How is it done?
Sure. So basically, you come in, you disrobe from the waist up, you acclimate for about 15 minutes, 10-15 minutes to acclimate to the temperature of the room, and then the camera is placed in front of you. Nobody ever touches you. The camera is actually reading the temperatures that you're projecting, so it doesn't project anything at you. And you just basically put your hands behind your head. I direct you into a few different positions, and you're all done. And then I go over the images with you, and women can tell immediately. And what's the most inspiring thing about it is once they engage and they take action, and then they can come back in about 3 to 4 months and literally see the difference. You can see it, and they're like, yes.
This is another important thing. After they have the first thermography, I don't know, a month later they can come back and see if the inflammation was reduced.
Exactly.
This is phenomenal, because you know if the path that you choose to heal is working or not.
Exactly.
You know if you have less stress and so on. And have you seen women that the inflammation was considerably large, let's put it that way, and then it was
drastically
reduced.
Mm-hmm.
How women react when they see this reduction
They're
of inflammation?
thrilled. They're like going off gluten and getting rid of sugar and not drinking and getting rid of toxic people is working, and so they stay on that path. Yeah.
Thank you so much, Gaea.
Thank you so much for having me.
Have you.
Thank
We
you.
have a couple
All right.
of questions.
Yes.
Rosie asks if thermography is covered by health insurance.
Well, what I
Let me repeat the question. Rose is asking if thermography is covered by insurance.
Okay, so I charge $175, and you could get a breast thermogram for about $175 to $200, and most insurances won't cover it unless you say this to them. and you say this to your doctor too, I'm happy to have your mammogram because that's what they want you to have and that's what they'll cover, if you will put in writing to me that it will not cause me cancer or spread cancer if I have it. If you can guarantee me that in writing, I'm happy to have it. And since you won't, because we know they won't, even the doctor nor the insurance company, you then say, then I respectfully request that you cover my thermogram. And so more and more insurance companies are covering them because we tend to forget we're the customer and we drive what we want covered. They don't dictate to us. It's our bodies.
Exactly. And we have to be proactive, keep asking the insurance, because that's
That's
the
right.
way that eventually most of insurance are going to cover, right?
Yep, and you have to just use those type of terms. I also have a document on, there's a website, if you go to breastexpose.com, there's a document you can print out and actually take to your, to the imaging center or your doctor, gynecologist, or whoever's trying to, bully you in or kind of, coax you into having a mammogram, and have them answer those questions because it's pretty straightforward.
Can I download that document and send it
Yep.
to all my emails?
Sure, absolutely.
Any other
One more
question?
question. How often should thermogram be monitored?
Well, depending on
Let me ask because
Oh, okay, I keep forgetting.
I repeat because people can. And the other question is how often thermographies
Should be monitored.
should be monitored.
The average is once a year. Women just like to keep an eye and a pulse on their health. If there is inflammation, or even if there's a significant amount of inflammation, we suggest you come back in about 90 days to 4 months and not pressure women because they know like how much they've been able to achieve, and are they doing lymphatic breast massage? Have they cleaned up their diet? So 90 days to about 4 months when they can really start seeing a difference. So that's a good way to monitor when there's a pretty significant issue.
Is it a good idea if a woman feels some lump in the breast, just go to thermography?
If a woman feels a lump, it's good to have a thermogram because it can really tell if there's heat backing that. And an ultrasound can determine is that lump fluid filled or a dense object. So a dense object would be more serious, but neither technology or no imaging technology diagnoses cancer. So if I personally, that's where I can speak from because I'm not a doctor, if I felt a lump and I suspected that it was cancer, my thermogram showing there's heat backing it, and I may have an ultrasound to, clarify that and not be bullied into the mammogram because it could crush, whatever's going on there. You don't want to harm it more. I would have a liquid biopsy. So I personally would never, if I had cancer anywhere in my body, allow anyone to stick a needle in it because you're going to puncture it and the cancer cells spread. That's just a fact. There's no way around it. So a liquid biopsy, blood drawn, and we have such high-tech blood tests now that can determine, do you have cancer cells? What type of cancer cells would that be indicative of like breast cancer, colon cancer? So we have so many other tests that are so less invasive. That's what I would do personally. And personally, I had a cancer on my face that was very invasive from stress. I wasn't managing my stress well because I eat clean. So it really shows you that, even practitioners or people that eat healthy and don't eat sugar or gluten and all of those things, that emotional factor is gigantic. Not dealing with my mom and the grief and, just different things. We all have things that we're carrying with us and trying to, manage those things better. So once I experienced the tumor on my face and I healed it naturally, I concluded under no circumstance would I ever let anyone dig at it, cut into it, stick a needle in it. It's like it would just be like a wildfire.
Exactly.
So that's just my own personal opinion.
Yes, and this is another great use of thermography because many women may feel a lump and it's just a liquid, a cyst that is a liquid. There's nothing wrong with that. With a needle they take the fluid and that's it. However, many of these women may be led into fear and the whole circle again.
Well, they don't realize that if you have fluid-filled cysts, like they'll tell women, oh, you have fibrocystic breasts. It's like, well, are you having enough magnesium? Like there's different ways to eliminate cysts by getting your balance instead of just, flippantly saying it's a cyst or you have fibrocystic breasts. It's like they don't tell you, well, how do I, heal that or manage it? And the other thing too is that because I've imaged so many women and I've seen all different ages. I've seen women who've got serious problems in their 20s, and then, what happens is if women are being overdiagnosed and overtreated for cancers that are stage 0, which isn't even
Exactly.
cancer, so DCIS is not cancer, or stage 1 or 2, if it hasn't metastasized, and even if it has metastasized, you have an issue and you need to figure out what the root of it is so you can be on your healing journey, and maybe trying to step away from this curing it. So sometimes if it's well established, or say your age is a huge factor. Like I have one woman in particular, she's 70 years old. She's had a very stressful life, with two disabled children, and now she's taking care of her elderly husband. And so she, was diagnosed, her thermogram was high risk, that something was wrong. She was diagnosed through a liquid biopsy that it was was cancer. And there was a lump, so everything's concluding, okay, you have cancer, but now what? So everyone's like, surgery, she's being bombarded with all this information and trying to scare her. And so I said to her, it's like, what's important to you? Because, you're 70, right? So the life expectancy of women is into their 80s. So would, you die just of a different death, just from old age, it's up to you to decide, and maybe just keep it managed, like controlling it.
Exactly.
Instead of trying to cut it out or ever think it's going to completely go away.
Exactly.
So if we're constantly obsessed or mining for it, you're just going to put yourself in a state of making yourself more sick. So surgery or always waiting for it to completely be gone, if we could just end the fear of it and treat it more like a chronic condition, and really consider your age. Anyway.
There is another important thing that I remember. I interviewed Dr. Pristupa, and he told me that many women, especially young women, are rushed into surgery when they have just a calcification that has nothing to do with cancer. Can you tell a little bit about that?
Sure. Like calcifications, I learned this from Dr. Carolyn Dean, is usually you're not getting enough magnesium. So they tend to bombard us with calcium and think that we don't want to get osteoporosis, so take all this calcium. Well, we really need to make sure that there's a 1-to-1 ratio of magnesium and the proper absorbing type of magnesiums, because magnesium, every cell in your body needs it, and it helps to absorb the calcium. So calcifications are caused by your body can't absorb it, so it creates kidney stones and calcifications in the arteries and in your breast tissue. So what'll happen is if they see a calcification in the breast, what they tend to do is panic. It makes them a lot of money, but they want to take it out, and then they want to radiate the woman's breast. So anytime I hear someone tell me that they only did radiation, I'm like, did you even have cancer then? Because usually if it's cancer, they want radiation and chemotherapy.
But Gaea, when I was in the cancer clinic, working in the cancer clinic, I won't ever forget this. There was a woman, beautiful woman, maybe 28, tall, beautiful yoga teacher, practiced meditation, and her face, she was so in panic and despair.
Aww.
Because they told her that you got cancer, and I always remember that was 15 years ago. Maybe it was a misdiagnosis.
Oh, absolutely. Millions of women have been misdiagnosed. There was a study done in Canada with over 90,000 women, for over 25 years that, basically proved that mammograms have not reduced the ultimate mortality rate, not by 1%. And I learned that from Dr. V. And then there was the Nordic Cochrane Institute, and their data people, they don't, and I learned this from Dr. Getson, they do not give opinions. All they do is collect data and then provide the information. Well, in mammography's case, they concluded that millions of women have been overdiagnosed and treated for cancers they didn't have, and or they're so it's such an early stage that it was so invasive and they lose their lives. So.
But many young women lost their breast.
Well, and that's the other thing is like they're told they have the BRCA gene, or so many women that come into me you can almost feel the fear in the air because they're so convinced because their mother or aunt had cancer that it's not a matter of if, it's when are they going to get it. And I'm like, what have we done? So we teach women or young women that we can do anything and we're beautiful no matter what shape we are or what package we're in, and that our sexuality is part of that. But when you
Exactly.
turn 40, your breasts are now landmines that can go off and kill you. So how did that happen? Instead of,
That's not true.
instead of also, like a tribe, like, gathering around someone and helping them heal and not pushing them or scaring them into things that they'll regret.
But listen to this. I was in the cancer clinic, integrated cancer treatment. The treatment was hyperthermia, which is heating the tumor. Unfortunately, in the US, has to be done along with radiation. But I will never forget 2 women that came from another state. And I remember the faces of the husbands who came, very humble. And I learned that these 2 husbands, in different years, they were doctors. So when their lovely woman, his wife, was diagnosed with breast cancer, being a doctor, they didn't rush into surgery. There is a reason. And they went there and they healed. They were cured. But they came with their husband. I remember the humility of the face of the doctor that have to
Very
swallow their
interesting.
pride. What they studied in medical school, I came to an integrated cancer treatment to save their women's breasts.
Yeah.
So it's what you just said. Sexuality is very important. And sexuality, you're going to enjoy even over 50. I don't even know those details, but for sure, you don't need to lose your breast when you are in your 20s or your 30s or your 40s, not even your 50s.
No.
It's a crime. It's
It really
literally
is.
a crime.
It is. That's how I view it. I really feel like it's been a crime against women, and that women should also insist on the people that have perpetuated this and have been involved in this should really be looked at.
Exactly.
Because it doesn't
Exactly.
need to be this way, and we do need to inform each
Yes.
other and empower each other. And the other thing that's great about thermography more recently is that when I image a woman, and they have brought their husbands, they're like, they want their husband to come in and look at the images too. So educating the men,
Exactly.
and then men need to also participate and make sure that their daughters are being protected and their wives are being protected. And if they do go to an imaging center and they're trying to get an ultrasound, the men should go with them.
Exactly.
And record all your
Exactly.
medical appointments. Always take electronic notes, smartphone. Just say, hope you don't mind, I'm the client.
Yeah.
And all the bullying will vanish right out the window. And then the other inspiring thing is that women are also starting to bring in their daughters. So even like 14-year-old, 12-year-olds even. So it's more of a celebratory type imaging to be like, look at and all my hard work and look how it's better. So it's these young girls aren't living in fear.
Dr. Preistupa has 2 presentations, the thermography for women and thermography for men. It's an excellent presentation. So I would like to, I know that we can be talking for another hour, but I would like to close with this. Get your thermography done. It's $175 to $200, which is about 4 dinners with your loved one, which is nothing. So I really don't understand, Gaea, when somebody asks me, is it covered by thermography? I said, it's $175, $200 in LA. It's worth it. It's well worth it. So people, the problem that we have is people are brainwashed on the system. If insurance doesn't cover, I don't do it.
Right.
And this is very serious.
And it could cost you your life. In fact, some of the
Exactly.
better insurance that you have, you might be in more danger. Because
Yes.
now you're having all the screenings mining for things.
Exactly.
Yeah.
Thank you so much.
Thank you. I appreciate it.
Get your mammography. Sorry. We have to edit that. Get your thermography done and watch this documentary.
Thank you.
All right. Give me a hug. Wow, that was phenomenal.
There's
Thank
one
you.
more question.
Okay. Oh yeah, go ahead.
It says, this is from Brenda. My friend's husband has just been diagnosed with rare breast cancer, a phenomena happening more and more to men now also. Can you speak about breast cancer in males, please?
I want to just talk a little bit. Dr. Preistupa addressed that, but do you have any experience with that?
I do. I've had not many, but I would say I've imaged probably about 10 to 15 men, and just being able to do the torso. And then sometimes I'll just go ahead and do their face too, so they can just be more in touch, because it's all connected. And a lot of cancers and issues start in the dental. Like if people have had root canals or amalgams or whatnot. So just men getting more in touch too, and we are so visual, so it's very helpful when it's not just numbers, but it's the same healing journey. It's about dealing with what is at the root of it.
But I don't have any information. In men, how does it express?
It looks the same way. It's it's just that the breasts obviously hang outside of the body, and there's this against the chest wall and the muscle, but it would be more inflamed on one side.
And they can notice that.
Oh yeah.
Okay.
Yeah.
Men, if you have an inflammation that you can notice, something is different. I don't know if there will be some pain, but obviously, since we have a flat breast, we easily will find, I guess.
Yes, I've seen, and I've even imaged a young man that had a lump, so to be able to correlate. But again, don't panic. Like, let's try to help you heal.
All right, so thermography is for men too.
Thank you so much.
All right, no more questions?
That's it.
All right,
All right,
phenomenal.
thank you.
That was great. I'm going to stop the live video. I need to take my microphone. Oh, Brenda. Hello, Brenda.